Malignant Cattarhal fever. It's an acute, lethal disease with febrile illness with general symptoms such as hemorrhages, pneumoenteritis, central nervous system signs such as encephalitis and keratoconjunctivitis. The occurrence is worldwide. It's a sporadic disease. The etiology of the disease. So the gamma herpes virus has the macovirus genus, and this genus has the ovine herpes virus 2 and the alcypine herpes virus 1. The gamma herpes virus causes a latent infection in the lymphoid cells. So the epidemiology. It affects sheep. They're the primary host and they're mostly asymptomatic, and the virus is shed in the discharges such as amniotic fluid. The virus can also infect cattle, bison, roe deer, and banteng. They're susceptible, also swine, but these are dead end hosts, so they do not shed the virus. In Africa, the wildebeest is a reservoir for the alcypine herpes virus 1. It's shed in 4 to 6 months. Cattle in Africa can get this if they share a pasture with wildebeest. And in Europe, the sheep is the reservoir for the ovine herpes virus 2. This is shed a bit later, around 6 to 9 months. And goats are also a reservoir for the Capra herpes virus 2. This can infect buffalo and roe deer and causes malignant Cattarhal fever. Older animals are more susceptible and younger animals are more resistant. The pathogenesis is not fully clear. An aerogenic infection leads to primary replication of the virus in the nasal mucosa. This leads to viremia, and it causes blood vessel endothelium damage, and it causes vasculitis in every organ. The viremia allows the virus to spread to the lungs, liver, gut, fetus, and brain. The immunopathological process causes the clinical signs. The clinical signs: the virus is found in older cattle after prolonged contact with sheep. The peracute clinical signs of the virus are death within 1 to 2 days, fever, anorexia, depression, and bloody diarrhea. And the acute signs of the virus are respiratory, central nervous system, and abortion. For the respiratory system, the serous nasal discharge becomes mucopurulent with a secondary infection, and it leads to coughing, conjunctivitis, a reddened necrotic airways, and ulcerated mucous membranes in the nose. For the central nervous system signs, we can see ataxia, recumbency, and paralysis. And we can also see laminitis and bloody diarrhea. The pathology of the disease, so it causes hemorrhages and edema, and hemorrhagic pneumonia and enteritis. You can see swollen lymph nodes and fibrinoid necrosis in the arteries. For the diagnosis, ovine herpes virus 2 can't be isolated, so you need to look at the clinical signs, post-mortem lesions, and follow epidemiology rules. To directly diagnose, you can detect an antigen using a PCR of the organs and the discharge. For the treatment and prevention, there's no cure and no vaccine, so to prevent it, you don't keep sheep and cattle together.